Information about painful, thermal, and crude tactile stimuli enters the spinal cord at all levels. Much of it is conveyed to consciousness via the spinothalamic tract, one of the pathways in the anterolateral system. Small sensory neurons carry this information to the spinal cord, and collateral branches of the entering neurons ascend and descend for at least one segment before entering the dorsal horn. Consequently, information from one dermatome is conveyed to at least 3 spinal cord segments. The collection of ascending and descending collaterals at the tip of the dorsal horn is called the dorsolateral fasciculus, or Lissauer's tract. The entering axons then synapse with second-order neurons in lamina 1 and in deeper laminae. The second-order neurons send their axons across the midline via the anterior white commissure. The axons then turn to ascent in the anterolateral portion of the white matter. Small sensory neurons carrying painful, thermal, and crude tactile information from the trunk enter thoracic levels of the cord and send collaterals up and down to adjacent segments. Second-order neurons in the dorsal horn send axons to the contralateral side of the cord. Notice that information from the trunk is located ventrally and medially to that from the lower extremities. Sensory neurons conveying information about painful, thermal, and crude tactile stimuli in the upper extremities enter cervical levels and, as before, this information is conveyed to at least 3 adjacent segments of the cord. Axons of second-order neurons continue to be added to the contralateral spinothalamic tract of the ALS. Note that information from the upper extremities is ventral and medial to information from the trunk and lower extremities. The spinothalamic tract, carrying information about painful, thermal, and crude tactile stimuli from the contralateral body, continues to ascend. Note that the first-order sensory neurons that enter the spinal cord have small diameter axons, many of them unmyelinated. Spinothalamic fibers carrying nociceptive or painful stimuli have targets in the brainstem. On its way through the medulla, the anterolateral system sends information to the inferior olivary nucleus and to nuclei of the medullary reticular formation. Spinal reticular fibers also terminate in some nuclei of the pontine reticular formation. Second-order fibers projecting to these hindbrain destinations and to such places in the mesencephalon as the reticular formation, the periaqueductal gray, and deep layers of the superior colliculus suggest that nociceptive stimuli in particular are processed by a diverse network of neurons. Those fibers in the ALS that are destined for the dorsal thalamus continue forward briefly to reach the VPL nucleus. Notice that somatotopy is maintained here. Fibers carrying information from the lower extremities synapse with the third-order neurons located most laterally in the VPL, while fibers with information from the upper extremities synapse most medially. Axons of third-order neurons traverse the internal capsule and corona radiata to reach the primary somatosensory cortex. Information from the contralateral lower extremity travels to a portion of the postcentral gyrus located on the medial surface of the hemisphere. Similar information from the contralateral trunk and upper extremity is projected to the postcentral gyrus on the lateral surface of the hemisphere, with the upper extremity targets located more ventrally.